This is Senior Moments on Santa Clarita's hometown station, AM 1220 KHTS. My name is Joel Green. We're talking about issues in aging, your health, with Dr. Joshua Schroll, who specializes in pain medicine, Dr. Michael Shih, who practices internal medicine and nephrology, and Dr. Ritu Vahi, who also practices internal medicine and nephrology, all from UCLA Health. Doctors, let's talk about polypharmacy. What is polypharmacy? Dr. Schroll?
Polypharmacy is essentially that, especially as we age, the number of medications that we're taking, increases. And, there's a lot of important issues when it comes to taking multiple medications, one being any kind of interactions that those medications may have with each other or how they may interact with your body. It's an important issue to discuss with your physician, your pharmacist.
But isn't it okay if I go to one doctor and they prescribe 3 or 4 different medications, and then maybe I'm on vacation and I see another doctor and they prescribe a couple, just only 2 medications. And then I come back and I see another doctor, and they only prescribe 1 or 2 medications. Isn't that all okay?
Well, I guess if you're seeing specialists and they're prescribing their own different set of medications, I guess here lies in the importance of having a well-established primary care physician that you follow up with routinely so they can review your entire medication list with you and look for any potential interactions between the medications. And also, I guess in the elderly, every time we see our patients and review the medications, we kind of want to justify the necessity of each and every medication at every single time, because health is dynamic, diseases, change, things improve, get worse, so there's always, time to review the medication, see what is absolutely needed, what can be taken off, and that's kind of the importance of following up with the physician regularly.
Do you actually take patients off medications, Dr. Shih?
I do. I think it's really important. Every medication that we give, we feel the benefit outweighs the risk. But at times, either the disease process is gone and we should just take away the medication, or we should really think long and hard of whether it's going to continue to benefit the patient. And so, it is very important to take a look, especially as we get older, as we have more diseases pop up. It is really important to be very cognizant. It does become very important because of the fact that when you take many medications, it is very easy to mix up the medications, to take medications that many times when the directions are complicated as well.
So instead of, let's say I took an extra 2 or 3 blood pressure pills, really what's the big deal?
The big deal with that is you're increasing your risk of having falls. You're increasing your risk of being, unsteady. When you take too many blood pressure medications, you're risking lowering your blood pressure too much, which will, compromise the blood flow to your brain, making you feel lightheaded, faint, and can lead to falls. And that increases the risk of fractures, and then it's kind of a complicated cycle from there.
And would that apply to basically most medications, that you really could OD, you could overdose on different things?
Yeah, absolutely. I would just strongly recommend, anytime that you're, considering taking a medication that wasn't differently than it was prescribed, it's always a conversation you should have with your physician, your pharmacist. In my world, I see a lot of patients on pain medications. That's another issue where patients may feel as though they need to take more than what was directed, but it's always important to have that conversation with your doctor.
Well, pain medications are a very interested in what I represent home instead senior care. We have many of the patients that we deal with, the clients that we deal with, are on pain medications. So I'll speak for myself. If If I come in to your practice, Dr. Schroll, and I say, you know, Dr. Schroll, all I want you to do is just give me a prescription for Vicodin, are you going to do that?
I mean, I would have a conversation with the patient about, you know, the type of pain they have.
I just need a prescription now.
I would really try and, you know, get a good idea of where the pain
But I
is
just
coming
need the
from.
prescription. You don't have to do all that.
Yeah. Unfortunately, there's just a lot of risks involved with pain medications. Like we were talking about before, a risk of falling.
I won't fall.
Risk of overdosing with other medications. I mean, you obviously are immune to the effects of them, but a lot of patients are not. So that's.
Are you going to actually examine me before you give me that prescription?
Absolutely. I would examine you. I'd go through your medical history, try and figure out exactly what kind of pain, where the pain's coming from, ways we can address it with things besides pain medications, because there's a lot of things, ways that we can help people with pain that don't involve pain medications.
Wow, that's an innovative idea, huh? When we come back, we're going to ask, do you monitor your health on a regular basis? If you don't, maybe you should. You are listening to Senior Moments on Santa Clarita's hometown station, AM 1220, KHTS. Good morning, everybody. I'm Joel Green on Santa Clarita's hometown station, AM 1220, KHTS. We're talking with Dr. Michael Shih. We're talking with Dr. Ritu Vahi, and we're talking with Dr. Joshua Schroll. Dr. Schroll, during the break, I'm still trying to talk you into renewing my prescription for Vicodin,
Yes.
and I've been rather unsuccessful.
Yeah, you have a good sale, but yeah, I'm resisting.
So what's the big deal? I mean, why can't you just renew it?
So like we were talking before, you know, the thing about pain medications, you know, they're great medications for those situations where, you know, you fall, you break your leg, you know, you just had surgery. Basically, those situations where your pain is short term. But for those patients that, you know, that I see a lot of, that unfortunately the pain's not short term, it's something they deal with, you know, every day of their life. There's just not a lot of evidence in the literature, you know, research that using those medications long term is beneficial for your health.
We have many of the people that our group sees on a regular basis have things like chronic back pain, and they think that they could come to a pain specialist, and you could recommend a limited supply of a prescription medication, and the back pain will magically go away as soon as they take that pill. Is that realistic?
Yeah, and unfortunately, you know, pain medications really do just mask the pain. You know, pain is basically an alarm system for our body. It's telling us that, you know, there's some sort of injury going on, and it's a normal response. When that gets to the point that, you know, you're living with that pain all the time, that's when it becomes more chronic pain. And for those people, you know, especially when you're talking low back pain, there's a lot of things that we can do that don't involve pain medications, which, like we talked about, have a lot of side effects. You know, there's physical therapy, there's injections, epidurals, things where you can really try and treat the problem, which is, you know, there's multiple reasons for back pain, but versus taking medications that just kind of mask the pain and mask that alarm system.
In your practices, do different symptoms, if somebody comes in with a symptom, would the symptom, and I'm trying to think of the best way to phrase this, would the disease or the chronic condition be different depending on their age with the same symptom? Could it be different? If somebody comes in with back pain and they're
Absolutely.
45 years old, could that be different? Could the result be different than if they came in with back pain and they were, say, 70 years old?
Sure. So in terms of back pain, you know, a younger patient who may come in with back pain, more often than not, I guess Dr. Schroll can probably elaborate, I would think that I would be thinking about things such as trauma, some sort of injury to that area, those would be higher up on my thought process than perhaps, let's say, chronic arthritis causing pain. Because as we get older, the years and years of wear and tear on the body will do damage as well. And so we have to think about those things more in elderly patients than younger patients.
So obviously, when you're doing your assessments, your medical assessments of somebody, it's very dependent on age, on physical condition. What other factors go into this?
When we see patients, there's a lot of things that we take into account when a patient comes in with a symptom. Like I said, the age is an important factor. What other comorbid diseases, what other disease process they have, because it could be, it could be related to one of the diseases that they already have. What their functional status is like, what kind of physical activity they're doing. Younger people who might be exercising aggressively, involved in, extreme sports are more prone to injuries. You're not going to think of that in an elderly 60-year-old.
Right.
There you might be, like Dr. Shi said, thinking more of arthritis, or, if some other disease process, like if somebody has a history of cancer, this is like the extreme bad thing that you're thinking, but that kind of starts your thought process, and you want to make sure that you're not missing anything serious in the elderly people.
Do any of you use questionnaires in your practices?
I do use a questionnaire in my practice, basically trying to get an idea of, again, because I see patients with pain, an idea of where the pain's at, when it started. Actually, on the questionnaire, there's a diagram, so you can literally draw out exactly where the pain is, and those things are very helpful when it comes to evaluating a patient, and it also is a good source as far as the medical record, because those kinds of things can be stored in your chart.
I think also with questionnaires, for us in the primary care field with general medicine, it's really important to get a questionnaire in the beginning and start to fill it out. It gives, I think, patients a chance to start to think of their issue and let them start to target what they think is important with that issue. And so when we begin to speak about that issue, we can start to target exactly the cause, and the patient can be involved with the direction of the potential diagnosis and the care.
Patient input is important.
Absolutely.
And then there are questionnaires for screening for depression. That's kind of a very important thing that we don't want to miss, especially in the elderly, because it can be masked in the elderly. But it's an important cause for many problems that they may be facing.
And we're gonna come back to what that entails. The subject on Senior Moments is Issues in Aging, Your Health, with the doctors of UCLA Health. We'll be back after the break on your hometown station, AM 1220 KHTS.